Hi viewers, this is Dr. Iftikhar Aslam from Pakistan. Today I'm going to present a lecture on Giardiasis, which is also known as Giardia enteritis, lamliasis or beaver fever. In today's lecture, we will cover the information regarding the organism that causes the giardiasis and its epidemiology. We will also talk about the history of the disease, how it is transmitted, species it affects including humans, and clinical and necropsy signs observed. Finally, we will address the prevention and control measures as well as the actions to take if the giardiasis is suspected. Giardiasis is caused by Giardia intestinalis, a protozoal parasite. This organism is also called as Giardia lamblia, Lamblia intestinalis, and Giardia duodenalis. The organism isolated from humans, domestic animals, and most wild animals appear to be identical. However, it is possible that Giardia intestinalis is actually the complex of several different species or subspecies. Giardia intestinalis occurs worldwide and it is particularly common in warm climates. Giardiasis is widespread geographically in the United States with consistent increased reporting in certain states and regions. Whether this difference is of true biological significance or reflects differences in giardiasis case detection and reporting among the states is uncertain. This graph depicts the number of Giardiasis case reports by age group and year, as reported by the National Notifiable Disease Surveillance System, the United States, from 2006 to 2008. The source of this graph is Center of Disease Control and Prevention. There are two stages of parasites. The first stage is cyst and the second stage is trophozoites. The cysts can be transmitted directly between hosts or on fomites including contaminated water and occasionally food. Among humans, anal intercourse is mean of spread. Ingested cysts release one or two trophozoites in the small intestines where the trophozoites multiply. Many of the dividing trophozoites are carried towards the colon and insist along the way. The cysts are infectious when they are excreted in the feces or shortly afterward. Trophozoites may also be found in the feces, particularly in diarrheic feces. The image you can see here is coming from CDC that reviews the life cycle of Giardia. As previously stated, the cysts are resistant forms and are responsible for transmission of giardiasis. Both cysts and trophozoites can be found in the feces. The cysts are hardy and can survive several months in cold water. Infection occurs by ingestion of cysts in contaminated water, food, or by fecal or root. In the small intestine, the excitation releases trophozoites. Each cyst produces two trophozoites. Trophozoites multiply by longitudinal binder fission, remaining in the lumen of the proximal small bowel, where they can be free or attached to the mucosa by a ventral sucking disc. Excitation occurs as the parasite transits towards the colon. The cyst is the stage found most commonly in non-diarrheal feces. Because the cysts are infectious when passed in the stool or shortly afterward, person-to-person transmission is possible. When animals are infected with Giardia, their importance as reservoirs is unclear. Giardia intestinalis can be found in many domestic and wild animals, including dogs, cats, and ruminants. Infections are frequent in horses and pigs. Beavers may be the source of contamination in streams. While in animals, the incubation period of this disease is usually 5 to 14 days, most infections, particularly in adult animals, are asymptomatic. Acute, chronic, or intermittent diarrhea may be seen in some puppies and kittens. The clinical signs can include diarrhea or soft stools, a poor hair coat, flatulence, and weight loss or failure to gain the weight. The stools are typically light colored and mucoid and may contain undigested fat. Blood is rarely seen. Similar enteric signs have also been reported in some species, including cows and lambs. No gross lesions are usually found during the postmortem of the animal affected with this disease. Giardiasis is usually diagnosed by the microscopic examination of the feces using either stained preparations or unstained wet mounds. Either cysts or trophozoites may be found. The infections may be self-limiting, but the potential for zoonotic transmission should be taken into consideration. Fenbendazole, albendazole, metronidazole, tinidazole, quinacrine, and furazolidone have been used in dogs or cats against the giardiasis. To prevent the infection, untreated water from the lakes, rivers, springs, or shallow wells should not be drunk. In countries where the water supply may not be safe, untreated drinking water or ice should also be avoided. Methods that can be used to treat the potentially contaminated water include heating the water to a rolling boil for at least 1 minute, filtering the water through a filter that has an absolute pore size of at least 1 micron or has been NSF rated for cyst removal. Chlorination or iodination may also destroy the cysts, but these methods are less reliable and depend on the temperature, pH, and turbidity of the water. All raw vegetables or fruits should be washed before eating in water known to be uncontaminated. Good hygiene, such as hand washing, can help prevent the infection. It also helps spreading the giardiasis to the other people. People with giardiasis should not swim in recreational water for at least 2 weeks after the symptoms end. Fecal exposure should be avoided during sexual activity. Cleaning and prompt removal of the feces can limit the environmental contamination. Hard surfaces can be disinfected and should be left to dry, as the cysts are susceptible to desiccation. Pets and livestock can be infected from unsafe water surfaces such as lakes, streams, springs, and shallow wells. Keeping pets indoors can decrease the risk of infection. Vaccines available for dogs and cats can prevent infections and the shedding of the cysts. Their use is controversial. Well, with this, we are going to end our today's lecture. Thank you so much.
Can anal intercourse transmit giardiasis? Yes, anal intercourse can transmit giardiasis. Giardia, the parasite that causes giardiasis, is spread through contact with the feces of an infected person or animal. This includes direct person-to-person contact, particularly through sexual activity that involves fecal-oral exposure. Therefore, to prevent the spread of giardiasis during anal sex, it is recommended to wash hands, genitals, and anus thoroughly with soap and water before and after sex. Use condoms during sex, which can also help prevent other sexually transmitted diseases. Wash sex toys with soap and water after each use.